You are listening to the People Station on greatdayradio.com.
This is DJ Tyler. Thank you for tuning into greatdayradio.com. We are your party mix, online radio station, and podcast show. Do you have that special loved one you want to dedicate a song to? Do you want to give a special shout out to that special person or two? Visit greatdayradio.com, hit the Let's Talk category, and leave a 60-second message. Thank you for taking the time to listen to our shows and sharing the love.
This is DJ Mikey D. While I do not often discuss my personal life on air, I recently discovered I have the beginning stages of lung cancer. As you may or may not know, I am a combat veteran and have been going through the burn pit studies. As I consider treatment options, I've gathered extensive research on various aspects of cancer to share with you, my amazing audience. Lung cancer is one of the most fatal cancers worldwide, causing up to 3 million deaths annually. Only 1 in 10 patients diagnosed with this disease will survive the next 5 years. Although this was an illness that previously affected predominantly men, lung cancer rate for women has been increasing because of the rising ratio of female to male smokers. In many developing countries, public education about the dangers of cigarette smoking and effective cessation programs has contributed to the slowly falling rate of incidence of lung cancer. Lung cancer is still the most common cancer in men worldwide and the 5th most common in women. Stay locked in as we continue this discussion with my co-host, DJ D. Marie.
Welcome to Healthy Talk Podcast, the podcast where we explore the cutting-edge developments in medical science and health. I am DJ D. Marie.
And I'm DJ Mikey D. Today we're focusing on lung cancer and the latest advancements in its treatment. Joining us is Dr. Herbert Baker, an oncologist and researcher specializing in lung cancer. Welcome, Dr. Baker.
Thank you for having me. It's great to be here to discuss such an important topic.
While I mentioned some facts based on my research, let's start with the basics. Dr. Baker, could you explain what lung cancer is and some of the common symptoms people should be aware of?
Certainly. Lung cancer occurs when cells in the lungs grow uncontrollably, forming tumors that can interfere with the lungs' function. Common symptoms include a persistent cough, chest pain, shortness of breath, and in some cases, coughing up blood. However, it's worth noting that symptoms often appear in the later stages of the disease.
Early detection seems crucial. Are there specific risk factors that increase the likelihood of developing lung cancer?
Yes, smoking is the most significant risk factor, accounting for about 85% of cases. Other factors include exposure to secondhand smoke, radon gas, asbestos, and other carcinogens, as well as a family history of lung cancer.
What are some of the promising new treatments for lung cancer that you're excited about?
We've seen significant advancements in targeted therapies and immunotherapies. Targeted therapy involves drugs that attack specific cancer cell mutations, such as EGFR or ALK mutations. Immunotherapy, on the other hand, helps boost the body's own immune system to fight cancer by targeting checkpoints that cancer cells use to hide from immune attack.
How have these treatments changed the outlook for lung cancer patients compared to traditional treatments like chemotherapy?
These new treatments have dramatically changed the landscape. They often have fewer side effects compared to traditional chemotherapy and have been shown to increase survival rates and improve quality of life for many patients. It's an exciting time as ongoing research continues to identify new targets and strategies.
That sounds promising. I have early stages of lung cancer. Should I overly concern myself? What role does early screening play in lung cancer treatment?
Early screening is absolutely vital. Low-dose computed tomography, LDCT, scans can detect lung cancer at earlier, more treatable stages, significantly improving outcomes. This is particularly important for high-risk groups, like long-term smokers, and has been shown to reduce lung cancer mortality.
For listeners who might be concerned about lung cancer, either for themselves or loved ones, what steps would you recommend they take?
First, quitting smoking is the most important preventive step, and there are many resources to help with that. If you're at high risk, talk to your doctor about screening options. Also, staying informed about symptoms and advocating for yourself in medical settings is crucial.
Thank you, Dr. Baker, for sharing such valuable insights. Before we wrap up, Is there anything else you'd like to share with our listeners?
I would emphasize hope and progress. The developments in lung cancer treatment over the last decade are substantial, and continued research promises even more breakthroughs. Stay informed and proactive about your health.
Yes, and thank you all for tuning in to Healthy Talk Podcast. Be sure to subscribe for more episodes on the latest health advancements and expert interviews.
You are listening to the People Station on greatdayradio.com.
Hey party peeps, this is DJ Mikey D. I want to talk to you about an organization and many like them that are trying to rid cancer and support those who are fighting it. As a person diagnosed with cancer throughout my life, and having both parents dying of cancer, I know how your support can make a difference. This podcast supports cancer.org. They are a leading cancer-fighting organization with a vision to end cancer as we know it, for everyone. They are improving the lives of people with cancer and their families as the only organization combating cancer through advocacy, research, and patient support to ensure that everyone has an opportunity to prevent, detect, treat, and survive cancer. Call toll-free 1-800-227-2345 or visit cancer.org to get more information and or make a donation. Your donation will lead to better outcomes and longer lives for patients with lung cancer and other cancer diagnoses.
Welcome to Veterans Talk Podcast, the podcast dedicated to sharing the experiences and challenges faced by our service members. This is a two-part show where we just discussed lung cancer. As my co-host mentioned, he is going through a burn pit study through the Veterans Affairs and the University of Colorado Cancer Center. The goal of this podcast is to highlight this study and how it impacts our soldiers. I'm your host, DJ D. Marie. Today we're discussing a critical issue affecting many United States soldiers returning from overseas, burn pit exposure, and its lasting impact. Joining me is our own DJ Mikey D., a veteran who was deployed in multiple war operations and has been directly affected by this exposure. Thank you for opening up about your exposure and time you spent at war.
Thank you for your interest in discussing this important topic, and I'm glad to be here to share my experiences with our amazing listeners.
To start, could you tell our listeners about your deployments and how you came into contact with burn pits?
Absolutely. I served in Iraq and Afghanistan, and burn pits were the main method of waste disposal at our base. They burned everything from household trash to more hazardous materials like plastics, batteries, and even medical waste. During those times, we weren't aware of the potential health risks. These pits were just part of daily life. Additionally, I served in aviation units where we were exposed to jet fuels and other toxins.
When did you start noticing health problems? And do you believe they are linked to your exposure?
I began experiencing respiratory issues shortly after returning from my first Afghanistan tour in 2009. I had difficulty breathing, chronic cough, and unusual fatigue. Back then, I did not get observed until I returned from my last overseas tour in 2014, as I was preparing to exit the military. After seeing a few specialists, we concluded that these symptoms were likely tied to my exposure to the burn pits. Over time, it's become increasingly clear that many of my fellow soldiers are experiencing similar issues.
That must be incredibly challenging. How has this impacted your daily life?
It's been tough. Physically, I get tired more easily, and certain activities are harder. Mentally, it's a struggle too, knowing these issues might have been preventable. Navigating the healthcare system to get the right diagnosis and treatment has been an uphill battle, although recent efforts by the VA are starting to make a difference.
It sounds like a complex situation. Have you found support or resources that have been helpful on this journey?
The VA's Airborne Hazards and Open Burn Pit Registry has been a useful tool, providing a platform to document exposure and symptoms. Additionally, veteran advocacy groups have been instrumental in connecting servicemen like myself with the right resources and raising awareness.
What steps do you think need to be taken to address the ongoing issues related to burn pit exposure?
Firstly, there needs to be continued research into the health impacts of burn pits to establish clear links and determine effective treatments. Increased awareness and education among both soldiers and healthcare professionals are essential. Policies like the PACT Act are steps in the right direction, but implementation on the ground level needs to be robust and comprehensive.
Thank you, DJ Mikey D, for sharing your story and shedding light on this pressing issue. Is there anything you'd like our listeners to take away, or any last message you'd like to share?
I'd say it's crucial for fellow veterans to speak up and seek support. And for the public, acknowledging these sacrifices and advocating for better health care for veterans is vital. This isn't just a problem for those of us who served. It's something that affects our communities and nation as a whole. Overall, burn pit exposure represents a silent yet significant health battle for many U.S. soldiers. While strides have been made in recognizing and addressing the issue, continued advocacy and research are crucial. With increased awareness, policy improvements, and medical advancements, there is hope for better outcomes for those who have served and sacrificed. Addressing these challenges head-on not only honors their service, but also ensures they receive the care and recognition they deserve.
Wise words indeed. Thank you once again, Mikey D, for your service and for being here today. To our listeners, thanks for tuning in to Veteran Talk Podcast. If you or someone you know is affected by burn pit exposure, I encourage you to explore the resources available. Until next time, take care and remember to support our veterans.
Thank you for tuning into Great Day Radio. We are your online radio and podcast show. If you are interested in our affordable advertising, please visit greatdayradio.com and click on advertising. Thank you all for your support and looking forward to representing your company or products.
You are listening to the best podcast from the USA to the UK on greatdayradio.com.